And this is around the closure of the Penrhos Polish nursing home. Chris, over to you.
Thank you, Chair. Okay, so you should now see my slide set. As colleagues are aware, the Polish home Penrhos over just outside Pwllheli has for some time been having difficulties. Those difficulties are multifactorial. They have had some difficulties financially in terms of staffing and in terms of meeting the standards that are currently expected by the regulators, and have been working through trying to square off how they can best resolve and respond to those. We've been working with them, as have other partners and the regulators, as I referred to, with absolutely a clear common goal of ensuring that those who are resident in the home, that their welfare is of our primary focus and paramount to everything. Unfortunately, the board of the society that runs the home concluded recently that they were unable to continue, and consequently gave notice to ourselves and the local authority to that effect. We've continued then to work in terms of understanding this, and moved from the initial position of helping the board understand how they can deliver ongoing care in the home, to a position of working out what the best solutions are moving forward, having received that final position from the society board. The view that we've held as we've moved forward in that is to recognise that the services moving forward will need to be different from currently for lots of very legitimate reasons. And also that we need to be absolutely clear that whilst we wish the care to be of the highest possible standard for those individuals within the home, that we ensure that the impact of the society's decision has been minimised as far as possible, and any transition of service is as smooth as it possibly can be. With that in mind, we have secured agreement from Welsh Government in terms of how we can make additional funding available, so that the home is able to stay open safely whilst we work through a safe transfer and focus around individual needs. And that funding partly contributes to staffing support, some governance support to maintain the expectations that the regulator has laid down, and also some support in terms of how we're working in partnership with those involved to make sure that the solution works best for everybody to be able to maintain in a sustainable way. I want to be absolutely clear on some points, and the first is that we, as a health board and as a partnership, recognise that there is insufficient care provision in the Clean Peninsula at present to serve the residents of the Clean. Or rather to serve the residents of the Clean as we move forwards. And in part that relates to the changing demographics. An example being dementia care, and actually how can we best care for those individuals who have both dementia needs and non-dementia nursing needs, for example, and how is that done in other areas of the UK where such situations have arisen. So This is an opportunity, albeit a very unfortunate situation, but an opportunity to be clear that what we are investing in going forward is a solution that isn't going to bring us back to this point in 12 months, 24 months, 5 years' time, but that is a solution that is fit going forward. We have formed a project group, and that group now has been meeting. And the scope of that group is to be very clear in terms of providing guidelines for what fit-for-purpose, safe and sustainable services would look like for those individuals that have not just been served by the Polish Home, but are actually more widely in that geographical area. It's not just limited to nursing care beds, but of course has to involve nursing care beds. It's absolutely imperative that it's not the view of the health board, that it's the view of all of those involved, not least those people currently using those facilities and their families. And for that reason, the partnership project group that is now meeting is chaired by the local authority, not chaired by ourselves, and we're absolutely clear that it has to bring in the wide and varied views that will lead us to the best possible solution. With that in mind, now is a good opportunity just to be clear that anybody who wishes to contribute, whether formally on the project group or on some of the subgroups or stakeholder events that will lead us to that appropriate conclusion. Anyone who wishes to contribute is absolutely warmly welcomed and can contact either myself, the local authority, or colleagues in the West who are already on the board. We will then consider those proposals with our partners. That absolutely includes colleagues here today. We have a timescale that is aligned with the local authority requirements and when they need to take this back through their processes, focused upon implementing improved services as quickly as possible, but the right improved services for the reasons that I have already referred to. Thanks, Jack.
Thank you, Chris. I know we'll probably have some comments and questions on this, but
yeah.
A couple of things that spring to mind. I noticed that you've covered quite a few of our concerns, and I go back to the lack of provision to start with on the clean. There isn't adequate provision now, and I believe that it has been mooted that we could perhaps use Brimberrel as one of these answers to this. My understanding and what I've seen of Brimberrel doesn't give me much confidence that it is the right setting or that we can afford to lose the bed space that we would need in order to put this discipline in it. And I don't think Brimberrel would be a satisfactory solution. The other thing that I'm concerned about, and I know other colleagues are the fact that we need to keep these people within the confines of the communities, and also we need to be able to allow them to use the Welsh language and looking at that sort of thing. Now, I take on board what you said about project boards and how you're looking at this and how the Welsh Government has found some money to keep it open for a while. But there are 15, 18 NHS beds in this facility. We don't want to lose those beds. And I would hope that whatever decisions you come to around this could constitute major service change in which we would be very, very keen on seeing at the earliest opportunity because these are beds that we can't afford to lose in this area. That's what I've got, but I know we've probably got questions of colleagues.
Can I respond to those then first? So from a broom barrel perspective, I absolutely agree with you. There is no appropriate use of broom barrel in the longer term for individuals currently in a Polish home. I think where this has gained some momentum has been that has formed part of our emergency plan should, in the early phases of this, the society find themselves in a position where they had to almost shut up overnight. And it was right and proper that we had a plan for that. That no longer is a significant risk to us. And the use of brim barrel for that purpose, for any purpose in the longer term, isn't something that we're considering. However, brim barrel isn't just about the community beds. It's also about the teams that work out of those beds and the outreach that those teams can be doing to help support this cohort. So we do need to be clear, we're not talking about moving individuals into those beds longer term. We're talking about the teams supporting those beds, also supporting individuals out in the community, which is good practice. And as I say, the plan was really, should we find ourselves in a very precipitous situation, which I'm very pleased to say we're not in, albeit that this is a serious situation that we wish to move through. Absolutely acknowledge that individuals need to be within their local communities or the communities that they choose, and that language and social interaction within those communities absolutely a part of well-being. We are committed to that. We are committed to it being the right provision rather than the provision that fails to meet what is considered to be best regulatory standard. In terms of the major service change, absolutely, I wouldn't expect you to be involved in this at the earliest point. If we believe this to be major service change, I would expect us to be including you all the way through this as we get to that point, and very, very warmly welcome anybody that wishes to be part of that.
Thank you, Chris. I think what does, a little thing that does concern me is, and I nothing to substantiate this, but I do believe that some patients are being transferred and some staff are leaving already. I will take on board your invitation to go look at this process from the beginning, and I'll take that up with Carol and Jeff at the office, and I'm sure we can put something in place. Jeff, do you want to come in?
Yeah, I think this is very good news, particularly that the solution is moving forward rapidly. I think that's really important, and I think we could come out of this with something that's actually better than what we've got now, and involving all those community staff in this, I think, is absolutely essential, right? So I'm very pleased to hear the positive comment that Chris made.
Thanks, Jeff.
Thank you.
Jackie, can I make a comment, please?
Certainly, Mark.
So I think some of the coverage and some of the some comments from some political stakeholders have suggested that the ball is firmly in our court and we're the ones who are holding anything up. I would just want to express support for what Chris has said. You know, this is the solution will have to be a partnership one. It doesn't lie solely with the health board. So ensuring that the work of the task and finish group involving our partners moves forward, and it moves forward together, is really important to arriving at the right solution. You know, we want to do all that we can, but we can't do it all ourselves.